I'm Tricia Julian. I'm the Program Coordinator for Oncology Services at Fairmont General Hospital.
What diseases are chemotherapy and radiation generally used for?
Chemotherapy and radiation therapy are used for a multitude of different types of cancer. It depends on the type of cancer and the recipes, so to speak, that are used for the type of cancer depend on obviously what type of cancer it is, but also the doctor will refer to what is known as NCCN guidelines, and that is a gold standard that physicians use to guide them in treating specific types of cancer.
What are the different goals of chemotherapy?
Different goals of chemotherapy are very important for patients to understand. There are some instances where we're trying for a cure. For instance, for breast cancer or testicular cancer, some of those types of cancers have a good cure rate if found early enough. But there also are aims of control, where we want to just control the disease and treat it very much like a chronic illness, like we do diabetes. We also can do palliation with radiation therapy as well as chemotherapy, and palliation is alleviating symptoms for a patient. We might do a type of chemo to shrink a tumor so that a patient is more comfortable, so that it diminishes pain. Radiation therapy can be used for bone metastasis when patients have a lot of pain in their bones. It's used sometimes to control pain. So those would be examples of palliation.
And then what about sometimes chemotherapy and radiation are used prior to removing a tumor to try to shrink it first?
They are, and that is called neoadjuvant treatment. And a couple of examples of when that would be used is if a woman would have a very large breast tumor and she may have the tumor stuck to the wall of the chest, they would do perhaps neoadjuvant treatment, which is chemo done before surgery, which would be the primary treatment, in order to shrink that tumor so that the surgeon had to do less tissue removal. Another example would be in children who have osteosarcomas, where they've got a tumor in their limb, in their arm or their leg, and it used to be that physicians would amputate the arm or the leg because there was such a high degree of metastasis into the rest of the body with those types of tumors. But if they do neoadjuvant treatment before the surgery on the limb, a lot of times they're able to spare the limb and not have to do as extensive surgery as they would normally if they didn't do the neoadjuvant treatment.
Are chemotherapy and radiation generally given at different times consecutively rather than?
Yes, that's how it's most frequently done. They'll usually do chemotherapy first, followed by radiation therapy. The reason for that is anytime you give two treatments simultaneously, it increases the side effects. There are, however, some guidelines for specific types of cancer where radiation and chemotherapy are given together.
Why is generally the chemotherapy given first?
The chemo being given first is just what they have found in clinical trials to work best, and that's what guides the NCCN guidelines or clinical trials. They're very, very important in helping to determine what works best in terms of treatments.
What can a patient expect when he or she gets chemotherapy?
When a patient first starts out and is first diagnosed, it's a very, very frightening time for them, and they have no idea what to expect, and they're completely overwhelmed by all the information that's given to them. But when they start to realize that they have to take day by day, just take the first day that's in front of them, handle that, and take the next day and the next day, they're able to handle it in a manner that is manageable for them. What they can expect from chemotherapy is, number one, nearly all patients have some level of fatigue from chemotherapy. It makes you feel almost like you ran a marathon. That fatigue can last anywhere from a few days to the entire course of treatment, and patients just have to take it easy and listen to their bodies and rest. Some of the other side effects can be, of course, everyone knows the one of nausea and vomiting, and we have a lot better drugs to control that now. We stop short of promising patients that they're not going to have any, but we try to control that very efficiently with drugs. They can have some numbness and tingling in their hands and feet. They can have diarrhea. They can have a lot of different side effects, most of which can be treated with perhaps another medication or by cutting back on the dosage of the chemotherapy. So the doctors watch that very carefully and will adjust the dosages accordingly.
Mm-hmm. Do the doctors generally sometimes give some of the medicines for side effects with the chemo, or do they wait?
Absolutely. No. They do not wait for those side effects to occur. They will pre-medicate the patient up front, especially for nausea and vomiting. We medicate almost every patient up front for nausea and vomiting. There are some chemos that cause very, very little nausea and vomiting, and in that case we may not medicate them up front, but in almost every situation they're pre-medicated for those expected side effects.
Do most patients get chemotherapy as an infusion, and if so, do they usually get it in a port that's been implanted? How does that work?
Most patients do get IV chemotherapy, and we encourage patients to get implanted ports for their chemotherapy when it is an infusion. The reason for that is we have a lot of patients, a lot more patients now, living with a cancer diagnosis or being cured. And for that reason, we don't want to damage the vessels in their arms, giving them chemotherapy, and then maybe 5 years down the road they need an IV for, say, pneumonia with some antibiotics. And if we have ruined their vessels in their arms with chemotherapy, then they're going to have a problem down the road. So getting the implanted port in is a fairly simple procedure to do, and it benefits patients tremendously, both because we can do the infusion of the chemo through it, but also because we can draw blood through it. Now, the chemo that we see, the route given orally has risen tremendously in the past few years, and there are lots and lots of new chemos that are being given orally, and so patients are taking that by mouth and are going home with a prescription for it and taking it. Now, they're followed very carefully by the doctor, because just because it's oral doesn't mean that it's less toxic or less powerful, so they need to be followed carefully by their oncologist with those drugs as well.
Mm-hmm. Okay. Is there a specific amount of time the oncologist generally waits before starting the radiation on a patient who's finished chemotherapy?
No, it just depends on the regimen. It depends on the type of cancer. It depends on the condition of the patient. If the patient's having a lot of side effects, they may wait a little while, but if the patient is doing well, they generally like to get them started right away with it.
Mm-hmm. And how, when the patient first goes in to be assessed for the radiation, what can they expect from that first appointment?
They will see the radiation oncologist during their first treatment, and it usually is a lengthy appointment for the first time that they go in to see them, and they do markings on them. Sometimes they do tattooing on them to mark the spot where the radiation therapy will be done, and usually in that first appointment they get their first treatment. And then subsequent treatments after that are much shorter in length, usually only 10 to 15 minutes. Usually they're given Monday through Friday, and most radiation treatments consist of about 30 treatments.
Mm-hmm. What side effects can patients expect?
With radiation therapy, it depends on the area of the body that's being treated. For instance, if someone is being radiated in the lower part of the abdomen, they can have diarrhea. If they're being radiated up in the area of the head for head and neck cancer, they can get a sore throat, a very, very sore throat, and the skin can get very irritated from the radiation therapy, but that's watched carefully, and they'll try to give special creams for treatment for the skin for that. So it depends on the area that is being treated. If their chest is being treated, they have to be careful to try to miss the heart and the lungs and the other vital organs there in the chest. So it just depends really on what area of the body is being treated.
Right.